Hi, my name is Prof Dr. Somashekhar. I'm a chairman of Medical Advisory Board of Aster Group of Hospital Global, and I am also a global director of Aster International Institute of Onco. It's actually my pleasure to be there in Apollo Cancer Conclave. I have attended this almost all the Apollo Cancer Conclave wherever it happens for several years. Like me, all the oncologists in India and academicians across the world look forward for this event because it's an excellent academic event of right mixture of Indian and abroad, and we also discuss about the Indian data. It's usually very well conducted, very nice, and subject specific like breast, then the gynec, the head and neck, colorectal track. So this is a fantastic event, and I would recommend it for every clinicians both in India and abroad to look forward for the dates of Apollo Cancer Conclave and mark in their calendar and not to miss attending this. Yeah, so as you know that human being brain can only do that much, and breast cancer is the #1 cancer in the world, and millions of data get generated in outpatient radiology, pathology and surgery. It is found that now artificial intelligence in breast cancer, both in pathology to assess breast cancer specimens, margins, prognostication of which patient can recur or not, and artificial intelligence in analyzing the screening mammogram and identifying the occult disease which can become cancer later. Artificial intelligence in cancer treatment. I did a big paper on IBM Watson AI and breast cancer treatment, which is published in Annals of Oncology. You can read, which showed that AI was superior to a group of MDT people. And not to lose this, now the robotic breast surgery which has come up in a huge way, and the planning of the treatment also, it has made a difference. So it is found that AI integrated breast cancer treatment is 80 to 21% better than human being alone, faster, very high sensitivity and specificity. This is not future, but it is current and present already. So it has walked into all our lives, and every oncologist who practice healthcare, especially breast cancer, should integrate AI in all the fields I told to achieve a greater excellency and then high patient care. Now what happens is, one of the AI field is mammography screening. You know that you have to study almost like 45 minutes of mammogram, all the fields with human naked eye with enlargement to see this density is abnormal, this is not abnormal, it is BRARS 2, BRARS 3. The moment you integrate AI into digital mammogram, in a split of second it will screen and let us know in this quadrant, this shadow, it will mark and say of high risk. You can just go and look at it. It is found that AI identified mammogram in a dense breast with a small occult lesion, 17% are better identified than human naked eye, and it identifies and doesn't miss any of them. Not to add that it not only improves efficacy, but it also reduces the time and subjectivity which human being adds is removed, and it brings standardization. This was the work of my paper which I presented in ASCO, and I was called in San Antonio to give a podium presentation where I published in Annals of Oncology that AI enabled treatment, when to give chemo, what chemo to give, what treatment to do, versus a group of oncologists, what we call tumor board decision. So we found that 14% AI based treatment was superior to a combined MDT, because AI can analyze millions of journals, thousands of clinical trials, 7,000 textbooks and articles, and it can decide for a given patient for this height, weight, comorbidity, IHC, genomic, this is the right treatment for them, and all done at a split of seconds in a 60 seconds, which we does. So AI is quite superior. It should be a part of each MDT in any cancer center. Absolutely. Whenever you have any machine there, you cannot prosecute a machine, you cannot prosecute AI, everything falls on top. This was an ethical issue initially which came. Suppose there is a treatment decided by AI, and then you end up treating it and the desired result doesn't come, who is responsible? So this is a very important question, ethical issue, privacy and then accountability. But the beauty is AI doesn't give the treatment. AI suggests a group of clinicians who himself is responsible to make a better decision. So there is no human clinician element that is removed. So that's why you go through this, put it in an MDT and you make a better decision. Ultimately the decision is between you and the patient. That's how to overcome the ethical issue. Having said that, it's very important, as of today law has not proved. Suppose a robot is operating, something goes wrong, human being to be blamed or robot, AI takes a decision to blame AI or not. That is one of the reason as of today AI independently is not allowed, should not be allowed to treat. It has to be through a qualified clinician recognized by law and accredited in that hospital and that institution. Yeah, so now AI will help us with screening and memo very quick, fast, identify early cancers. It will help during pathology to know whether you have done a complete surgery and what treatment outcome for that patient is better, surgical planning. And post surgery, it will tell which patient are high risk to recur, which are low risk to recur, and who should need more treatment after surgery. All of them bundled together, AI is going to remove the errors. Today, error in medical field and surgery is a big thing, because no two surgeon, no two hospital, no two human beings are same for that disease, for that patient at any given moment. So there is an error which causes lot of problem to the patient, which is beyond, because everybody is human being. So this AI will make treatment fast, more accurate, removes the error, removes the subjectivity, and brings a equal goal and outcome across the world at a very fast fraction of second, and it will make the healthcare very economical in breast cancer. Yeah, so I would always suggest everybody, artificial intelligence is not future, it is present. You should be wise to integrate it in all the phases: prevention, early diagnosis, treatment and adjuvant treatment, and follow up and surveillance. Otherwise you will be left behind, and then your patients will not get the right treatment which they deserve. So I recommend my colleagues to get trained in this and interrupt it. Thank you.